Hello everyone, myself Dr. Kanchan Sharma and welcome to my YouTube channel. I'm a qualified Ayurveda gynecologist and today's topic is breast abscess. Yes, this is a painful problem and breast abscess can form in anyone but more common in lactating female. And there is a confusion. Most of the women are confused. Should they breastfeed or should they stop? So everything is going to be clear in this video. And I will tell you that how can Ayurveda help you with this painful problem. So why are we wasting time? Let's get started. But before that, don't forget to subscribe the channel and hit the bell icon to get updated with all my latest videos. So let's get started. So what is breast abscess? Painful pus-filled lump are called breast abscess. Abscess can form at any part of your body. When they are present in breast, we call them breast abscess. Basically, they are a result of infection because pus is there. So there are two types. The first one is lactational, when women is breastfeeding. The second, when women are not lactating, they're not breastfeeding. Now let's discuss what are the causes. The main and obvious cause is bacterial infection. Staphylo and Streptococcus bacteria are responsible. If you are lactating, bacteria came from the oral cavity of baby and can enter through the cracks of the nipples in your breast, and then infection or abscess can occur. And if you are not lactating, but if there is any wound, any cut or any kind of surgical history is there, then from that bacteria can enter and infection or abscess can occur. Very simple. But one more reason is there. Sometimes your milk duct is clogged. Why? Sometimes milk production is very much high and your baby is not properly breastfeeding, or you are not doing proper breastfeed. Milk is there, your breast have good amount of milk, but it is not going out. So then your milk duct can clogged and then abscess can occur. So proper breastfeeding is important. See, this is very painful when it happens. So, if your milk production is high, then you can use suction pumps also. Now, let's move to the symptoms. So, how you can identify your breast abscess in early stage? It is very important because if we'll identify in early stage, then we can easily manage with the help of Ayurveda and we don't have to go through that procedure, incision and drainage. So it is very good that we can identify in early stage. In Ayurveda, symptoms are well defined. According to the symptom, we can easily identify. And symptoms are based upon the Tridosh, Vata, Pitta and Kapha. So listen carefully, I am going to explain. If your abscess is quite blackish and there is lot of pain and you are also facing headaches, then definitely Vata Doshas involved. Vata resembles air. If you have warm breast, there is redness, there is fever, then definitely this is a Pitta involving abscess. Pitta resembles fire. And if the abscess is quite hidden, it is quite whitish and not warm, even if you touch the abscess, you can feel the cold. Maybe itching is there. Then there is Kapha involvement. And when there are mixed kind of characters, then we call them Sannipata Jistan Vidhridi. And sometimes one more type is explained in Ayurveda, that is Abhighatash, traumatic. So traumatic, it means any kind of trauma, any kind of surgery, any kind of cut is there. That symptoms are actually similar to the Pitta one. The warm breast, the redness, the fever. Yes, so these are the symptoms, and in Ayurveda we identify the symptoms and treat patient according to the symptoms. So see, everything is well explained in Ayurveda. So if you are facing any kind of discomfort or pain on that area while breastfeeding, you can take Ayurveda medicine easily because antibiotics and painkillers can harm your baby also. Because when you are breastfeeding, you are giving those to your baby also. So why you are taking those? Just take an Ayurveda treatment and this will definitely cure you in early stage if you are. But if you want consultation with me, you can contact by this WhatsApp number. Now let's move to the treatment. So if you are in early stage, your abscess is not very big, you have mild pain and this is an early stage, you can identify yourself. Then what you have to do? Don't forget to breastfeed your baby. You have to breastfeed, but because of the pain, women are not able to do that. Then what you can do? You can use warm hot water bottle at that area, and when pain decreases, then you can breastfeed. But if you are not able to do that, you can use suction pump. Sometimes you can't do to yourself, then take anyone's help for that. Okay, so you have to breastfeed. Now what you can do? The other thing is that in Ayurveda we gave you medicines for that, the Triphala Gugul and the Keshor Gugul, 2 tablets twice a day after breakfast and after dinner. They will definitely help you. And you can also take Arak Vadadi Kashayam. 10 ml, you have to take 10 ml before your breakfast and before your dinner. So these are the medicine, they will definitely help you. But if you are in chronic stage, your abscess is very much big and you are not in a good stage, then Shastra Karm is indicated in Ayurveda also. An Ayurveda doctor can give you incision at that area. But what is the difference between modern science and Ayurveda? That we do packing of that area with the help of Jatyadi oil. We do this for 10 to 12 days on alternate day, and we can do this in our science. This is indicated, the Shastra Karm. The abscess is very much big, then we have to incise that area, but we don't use antibiotic. We use our medicines, which I have already told you, and we do packing from the Jatyadi oil. But if incision is not required, sometimes we also use the Shang Lep. So see, this is the vast science and we have proper treatment for the breast abscess. So you can use that. If you want my consultation, you can take that. I hope you like this video. Thanks for watching my video.